The last thing that we need to cover today is how to get safely in and out of the bathtub shower. You will need something to sit on while you're in the bathtub or the shower, regardless of whether it's a bathtub shower combination like this or just a shower stall. If you have a shower stall, I do not recommend that you sit on a built-in shower seat. Those are generally low and they're generally not very deep this way, and you end up kind of perched at the edge. So I do prefer that you have something separate to sit on for in the bathtub or the shower. There are two basic options available out there. This option is what we call a shower bench. It sits both inside and outside of the bathtub shower. The second option is what we call the shower seat, which is this, and this one sits entirely inside the shower. I'm going to show you how to get into the bathtub using both of these options. Please know that neither of these are covered by insurances of any kind. This is an out-of-pocket expense. I would prefer, if you don't already have something, that when you're here we can practice on both so you can see what you like better and we can get you whatever you need. All right. When you're using the bath bench, you'll back right up to that seat, lower yourself down gently, and then you can use the cane as a leg lifter to get your legs up and over the edge of the tub. You'll sit while you're showering, and when you're done, have somebody bring the cane back so you can get your legs back out. Get yourself squared back up on that chair again. While you're still sitting here, you're going to get as dry as you can be. I don't want your arms and hands wet trying to grab a hold of that walker. I don't want the rest of your body wet making puddles on the floor that you can slip and slide in. Get dried off, get your walker, and get yourself back to bed. The other option is the bath seat. This sits entirely inside the bathtub or shower. You'll do exactly the same thing, only in this instance, as I back up to the seat, I don't feel the seat behind me, I feel the bathtub behind me. I need to double check visually that I'm squared up on that seat, reach back, and lower myself down gently. Again, you'll use that cane as a leg lifter to get your leg up and over the edge of the bathtub. And again, you will sit the entire time you're showering. When you're done, get that cane back. Get your legs back out of the tub. Get yourself squared back up on that chair and dried off before you start to move again. The last thing we need to discuss today are your hip precautions. These are the rules that will be in place until your doctor tells you otherwise. These are things we do not want you to do with your new hip. Your first rule is no bending past 90 degrees. Now when we're talking about 90 degrees, we're talking about the angle between your torso and your thigh. So when I'm sitting upright right now, I'm at 90 degrees of bend. You can go back as if to lay down, but we don't want you going forward towards your feet, which means you will have to use the adaptive equipment for getting dressed until the doctor tells you otherwise. That also means if you're sitting in the shower and you need to adjust the temperature of your water, you will not be able to bend forward to adjust the temperature of your water. That also means if you're laying flat in bed and all your pillows just got shoved around your feet, you will not be able to bend forward past 90 degrees to straighten everything out. That also means if you're sitting down eating your breakfast and you were looking at the paper while doing so and the paper just slid to the floor, you will not bend over to pick that up. I would recommend that you keep that reacher with you throughout the day. You can keep it at your walker, and we'll show you how to do that once you get to the Grove Street facility so that you will always have something with you that you would not need to bend over to get things. So the first rule for your hip precautions, no bending past 90 degrees. The second rule is no crossing your legs. Obviously, you will not be sitting like this. That also means you will not be kicking your shoes off like this or itching that spot on the back of your leg with your other foot like this. We would like, when you're laying down during the day, to have the pillows that are under your knees, at least one of them going in between your legs as well, so that you do not accidentally cross while you're lying down during the day resting. You will not be able to sleep on your side until the doctor tells you otherwise. As soon as I get onto my side, gravity pulls my leg down into that crossed over position. So no bending and no crossing. The last rule is no twisting over that new hip. That means if somebody has brought your clothes to your bedside for you to get dressed in the morning and the phone rang and they went to get it and they dropped your clothes over here, you're not going to twist all the way over like this to grab those clothes because you've just twisted over your new hip. That also means when you're going to move with your walker, and I'm going that way, I'm not going to move my walker and then just twist along behind it. You'll need to take small steps when you're turning with your walker, keeping your walker and your body pretty much in the same general direction so that you're not twisting over that hip. That also means that you may find when you're in the hospital and that extra fluid weight is on that you have difficulty wiping. Now, the seats of the toilet have handrails here. You can't twist this way to get anything. You can't get there from the front. You'll have to stand to wipe with the walker in front of you. Make sure all of that motion comes from your hand and then you're not doing a giant twist over that hip to get to things when you're wiping or when you're getting cleaned up in the shower. You will be getting a handout about your hip precautions. We'll go over them more in detail while you're in the hospital. But please keep in mind all of these rules are in place until the doctor tells you otherwise, and that will be beyond the first 2 weeks. This is important that you follow these hip precautions so that your hip does not dislocate and that soft tissue can heal the way it needs to heal to keep everything in place. So to review, for the first 2 weeks following your surgery, we do want you to stay at home, in your home, while you're recuperating. Do not step outdoors again until you're going to get in your car for your 2-week follow-up visit. Make sure you're using a walker every single time you walk until the doctor tells you otherwise. Please limit the amount of time that you're up to no more than 20 minutes at a time, getting up for meals, getting up for toileting, and getting up for showering at least once a day. We also want to make sure that when you're laying down during the day, you have your leg elevated above the level of your heart, generally with a stack of pillows under your knee to keep that leg up and that hip in a comfortable position. You're allowed to sleep in any position that you want to at night as long as you're sleeping in a regular bed and not in a recliner. Please make sure that you do not do stairs more than once a day, and when you go back for your 2-week follow-up visit, the doctor will tell you what's next. If you have any questions in the meantime, please feel free to call the nurses station here on the rehab unit. The number is 814-333-5320. The nurses on this unit are excellent. They know the doctor's protocols inside and out. If you have any questions, they'll be able to answer them for you. If there's something that they can't answer, they will get a hold of the doctor and find out for you so that either he or they can get back to you. So do not hesitate to call if you have any questions at all.